afternoon, everyone. Welcome to this week's Microsoft Sustainability Dialogues in Saudi Arabia podcast, where we take a deeper dive into this massive acceleration that we're seeing towards sustainability across the kingdom, across the region, and essentially across the world, trying to uncover some insights and intelligence for stakeholders to help them navigate this pathway forward. We're tackling the critical question today of the future of healthcare, how to accelerate the adoption of green technologies. And we're joined here today with our special guest speakers, engineer Mohamed Sindi, who is the CEO of Philips Healthcare in Saudi Arabia, and Dr. Sara Al-Dallal, who's the president of Emirates Health Economic Society at the Emirates Medical Association. Thank you very much, both of you, for joining us today. Engineer Mohamed, I just want to start off with you to get your initial thoughts on this overall critical question that we're tackling this afternoon.
Thanks, Brian, and thanks for the invitation and the opportunity, of course. I think it's a very important topic, and especially when we talk about sustainability, which is going very much hand in hand with the climate changes, for example. We see that in healthcare, it's very important that this is something supposed to be in priority number one, because at the end of the day, if climate change, sustainability means healthcare. So of course, globally, we see, for example, the impact of the healthcare overall on the sustainability and climate change. It's something that maybe most of us, they don't know that it's a 4.4% carbon emission, among all other sectors. And sometimes it is even more than the shipping industry and the aviation industry. And this is something maybe, for me personally, I get to know about it very recently. So what I'm trying to say is basically it's a very important topic. That's why I think focusing on these initiatives and all the measures that we are trying to do in collaboration with governments, in collaboration with healthcare providers and private sectors and government sectors, and also manufacturers, is very important to achieve the goals that we are trying to achieve.
Thank you, Engineer Mohamed. Dr. Sara, I'd just like to bring you in on your opening comments. Just building off of that, health is really at the center of our push forward for sustainability. It's for a healthier future for everyone from all aspects across all sectors. So just your opening comments, Dr. Sara.
Yes, thank you, Brian. Thank you for the kind introduction. And I'm so happy to be among expert colleagues who are really looking forward to put the sustainability or talk about sustainability and how to move forward. As just mentioned with Mr. Sindi, he just mentioned that the healthcare sector is contributing to a fair share of the carbon emission or global carbon emission, reaching over 4.4%, which sometimes could be on a higher level than other industries where there are changes or could be changes done looking forward. And this is what is really promising in the healthcare field. No matter what is happening, the healthcare field is always booming. There's always things that there are always innovation and technology that has been adopted, changed, looked into. And it is very interesting to see how these changes can really provide a better future, a more greener future, and reaching to a net zero carbon emission, not beyond one area, but in other areas, and also to look into new innovative ways of doing things. And health is a core concept among other industries. So if we are having a healthier population, we'll be having a more sustainable environment for everybody to live in.
Thank you, Dr. Sara. Engineer Mohamed, just building off those comments, how would you assess the current state of sustainability practices to lower those emission outputs. How are you seeing that progressing forward? A lot of the conversations we have are essentially visions and action plans. Right now, it's implementation mode. What is your current assessment of the pathway forward from that perspective?
Look, if we talk in a specific, for example, in Saudi Arabia, so I think the recent announcement of Saudi Green Vision is the very important step because at the end of the day, nothing can be achieved without a collaboration between the private and the government sector. And usually, the government they need to take the initial step in order to achieve these kind of nation global kind of initiatives. So in Saudi, I think step number one was announcing the Saudi Green Initiative. This is something very important. Now, as you said, Brian, the execution is the most important step, not only setting up
It's
the
the
goal.
hardest stage of the process, right?
Exactly, absolutely, absolutely. So in order to achieve this, there will be a lot of things need to be done. So, for example, we know that in Saudi, we are not in an advanced stage when it comes to previous experience in implementing a lot of sustainability kind of measures. But also we have the ambition and we have all the tools that we can really shorten the time in order to achieve a lot of targets very soon. So, for example, I think one of the very important steps that we need to take is basically start, cascading those high-level targets into a small achievable targets over the coming years. We cannot set a target for the coming 20 or 25 years, for example, but we have to break it down. We
So
see, for example,
low hanging fruit, essentially. What can we achieve?
absolutely,
Yeah.
absolutely. And I can give you something from at least from my, my field and my experience. So, for example, in Philips or in some other companies as well, they start, introducing a lot of medical equipment, which is basically supporting the sustainability and the circular economy. So we talk about, if I give you a quick example, in the MRIs, the magnetic resonance devices, basically, usually this device is consuming from 1,500 to 2,000 helium natural gas in the normal operation modes. Right now, a lot of equipment has been introduced, which is only consuming 7 liters. So only 7 liters. So there is a big gap and a big saving from the natural resources. This is one thing. The other thing also, how to incentivize and support those companies and technologies, and also the healthcare providers, hospitals, and healthcare institutes to adopt those kind of technologies. So from one side, reducing the dependency on the natural resources, but also the power consumption. So if we compare between the state of the art or the latest model of the equipment right now with the previous equipment 5 years ago or 10 years ago, there is a huge saving in power consumption. So all of these are basically things that in collaboration between the private and the government, they need to keep it in focus, and they need to start thinking about how to push, incentivize, and help and support those kind of hospitals, big hospitals, to adopt those kind of technologies. It's not only about how this will impact the diagnosis and the patient, but also how to impact the climate.
Just as a follow-up question, a big challenge of that is, especially when you have such, I would say, innovative technology, is upscaling that technology, starting from point A to getting it into the market, essentially. And I think what we're seeing, obviously, Philips is pushing forward and driving in the industry, but some other sectors across the board, is there's a lot of technologies that are stuck in that pilot phase, that sandbox phase. What's your advice in terms of that upscaling process? You mentioned the partnerships aspect. What would you say is kind of the low-hanging fruit to kind of push things forward in that technology space?
Look, Brian, the example I give, it is one of the very, very, many examples. And this is mainly around devices, but also there is a lot of other technologies, a lot of other solutions. It's basically gonna support sustainability and also being scalable to cover more areas and to have bigger impact. So we are talking about, for example, let's say the telemedicine solution. So maybe in the first part, people will not really think that this is something very much correlated with the topic that we are discussing today, but it's very much impacting the sustainability and the climate change. One small use case that the telemedicine is basically can impact the climate change is you are reducing the dependency of visiting hospitals for patients to see doctors, right? So when you do this, so that means you are reducing usage of disposables, you are reducing the waste, you are reducing the transportation, you are reducing the power energy in the hospital. A lot of things that can be done. And also, it will take another development goal in the sustainability, which is basically more healthy living, right? So you can increase the healthcare accessibility, and you can increase a lot of other goals. So too many examples. But talking about the scalability, this is where you can take a lot of boxes from adapting those kinds of technology.
Dr. Sara, I just want to follow up on that with your comments on terms of the current state of sustainability practices within the healthcare sector. Engineer Mohamed mentioned partnerships as a crucial aspect of that. And of course, from your position, a lot of it is about partnerships. What are your comments and thoughts on that perspective?
Definitely, what Mr. Mohammed have just mentioned is very important. And partnership, to start with it, we need to set the expectations on both ends. We are more than happy whenever somebody is whatever receiving end you are from, is that they extend the arm to partner and collaborate. But to start with that, we need to put something that is feasible, and there's a common language that could put things together. Now, we are seeing certain innovation that has been promoted, but to really foster this innovation, there should be a hub to contain those innovation, and also that hub should be also looking at the impact of these innovation and incentivizing it in one way or the other. Mr. Sindi have mentioned how telecommunication or telehealth is being at the forefront of the healthcare sector. And I think in the last, probably, I wouldn't say the last decade, but you can see how
COVID probably helped accelerate that a
COVID
bit.
has accelerated that. But on the other end, I haven't seen any tangible results in terms of how did this really contribute to the carbon emission. Yes, we know that it saved a lot. And to be very honest, when we talk about collaboration, it's always PPP, public-private partnership. But what we need is also to bring the element of the patient or the customer at the end of the day into the equation. And this is where we need that kind of engagement. And you see, there are nowadays tools to do that. And without this, partnership can happen, collaboration can happen, but if the end user is not happy, then the purpose of the whole exercise will not reach its end goal. Now, we are seeing lots of countries going towards AI and predictive tools and automating all of these processes. All of this is cutting down unnecessary processes that were done on ground, and we are reducing carbon emission. So yes, I am into collaboration, but we are looking at this point. Yes, we have done this collaboration and we put some certain milestones that we achieve, but let's look and loop that with a good feedback system to get other end users, and also to really measure this impact on different level, on the society, on the industry, on the patient level or on the customer level, and also on the governance as a whole.
Well, as a follow-up, as you said, the end users are a critical pillar to this moving forward. You can only do so much from an industry and building the right environment for things to push forward in that sense. And of course, as you mentioned, this is just, it's across all sectors. We have to be able to measure and develop metrics on sustainability, ESG, and what we're doing, moving forward. What do you think is the first step in order to bring those end users more into the part of the process?
To bring the end users more into the product, I think awareness is the first and most important thing to really get the engagement of the end users. So maybe I'm not really, I don't know how to put this in words, but let's say if the end user is really well equipped to understand, for example, that these processes can lead to a green or sustainable thing. This is the first thing. So for the time being, I don't think any end user out there really, or maybe there are some people who are interested, but not many know that telehealth or consultations or telehealth in general really contribute to a green or sustainable environment. They are looking at the ease of things. So whenever we are sending, for example, these messages or these questionnaires or surveys, can we just drop a message and tell them, by the way, by your contribution, you have saved, for example, X amount of gallons of water or fuel or something of that sort. So we get that kind of engagement. And then we also get the engagement of really powerful, I don't know, like powerful thought leaders or even advocates to really talk the same language. I think if everybody agrees here, whenever you get probably professionals in the healthcare field talking to end users, it always seems to be very didactic, very boring kind of a thing. But we
Put it in
need
a
to,
tweet format or a Facebook post. I
yes,
might.
yes, or bring all of these young and energetic, really, like let's say social media influencers or something of that sort, influencers to really educate them and let them be our voice to go to these end users and really advocate for the topic itself.
Yeah, I think you touched on the ease topic, where I think we all know some of our friends who probably use WebMD or
Yep,
Google, and
yep.
just move it from there. And from there, it's just not leveraging telemedicine in that sense. But the ease, getting over that aspect and informing society more, will push things forward a bit. Engineer Mohamed, just building off of that, just your comments on bringing that pillar into the process, and of course there are technologies out there that can help process those metrics, the data, and give insights that will fuel and move things forward for sustainability and what that might look like.
Look, let me first thank Dr. Sara for, I think it's very important point. The awareness is something that is important. And I completely agree that usually the discussion between, the healthcare technology providers and the end users are going to a complete different discussions away from something called even sustainability. That's why when I say partnership, it was more between all the levels, not only private and government, but also even within the same institute. The corporate, the governance, they need to have a complete adoption to those kind of initiatives. From our side, for example, sometimes, and not sometimes, become most of the time, we are basically trying to send a message that adopting such technology, it's not about maximizing revenue. It's not about reducing costs. It's not about only improving healthcare, but also a lot of things that, it will impact the society, because at the end of the day, the whole approach of the healthcare, it's not only diagnosis and treatment, right? It's more about introducing better culture for healthy living. And with doing this, definitely this will be a bigger contributor to that angle. So I think the responsibility basically is being fairly distributed over everyone in the country or in the industry or in the company, that the sustainability, something need to be adopted at all levels. That's why in the beginning I was saying that it has to be cascaded, because if we talk about reducing carbon emission, for example, by 2050, by this percentage, how this will be done? What is going to be the share of each industry? How this is going to be the share between private and government? We need to see, for example, the initiative from the government first, because they are the biggest consumers, the biggest carbon emission contributors, and then what is going to be, the private targets they need to achieve, and what is going to be the incentive. So this is something very, very important, Brian.
And from your perspective, you had mentioned earlier, just coming from a top-down level, the massive amount of projects that are going on in Saudi. You have mega cities. You have the Green Saudi Initiative, Vision 2030. From your experience and perspective in the kingdom, what are some of the best practices that you've seen of being a part of that process that can be exported outward? As we had mentioned, the region's going through the same process essentially. I had a podcast last week on water security when we were talking about Saudi, transfer of knowledge to California, where I'm originally from. What has been your perspective on what you think, given that environment that's been created from the government, that could be transferred externally?
Look, maybe if we talk generally, not only in specific for healthcare, I think in Saudi, they become, or one of the very good practices is basically the amount of platforms that the government created, not only internally with different sectors and different industries, but also, globally, internationally. We see a lot of collaboration is happening with European countries, like I was for example, one of the roundtable around sustainability between a lot of government representatives in Saudi and a lot of representatives from Netherlands, for example, from UK. And this is something I think it will accelerate, shorten the time from sharing the experience, because I don't to do or to reinvent the wheel again, right? I need to start from where the others are basically reaching, and also to collaborate together. I saw a lot of discussions on agriculture. I saw a lot of discussions in energy. So, for example, we have the biggest energy company in the world, Aramco, for example, and I see how Aramco is contributing, going into a very detailed discussion with a lot of other countries on how basically they can export their experience on, they are, producing oil, but at the same time, they have a very solid plan on reducing the carbon emission, and they have a plan to reach to a carbon neutral goal. So this is something that I see very much from the government and also from the other flagship private companies in Saudi towards the sustainability climate change goal. On the other example, and specific in healthcare, for example, the biggest player in healthcare in Saudi is Ministry of Health. So we saw, for example, how they are basically helping, pushing, investing a lot in what they call Saha Medical Center, or the virtual hospital in MOH, which is basically they are trying to increase accessibility, reduce dependency to visit hospitals, and they have a very good understanding and very good kind of goals to achieve around sustainability. It's not only about providing healthcare to those people scattered around the kingdom, but also they have very solid targets, a yearly target, to reduce people from using, disposables, from going to hospitals, and this is directly linked with reducing the carbon emissions. So these two are best practices I see it in Saudi. Definitely, this is not enough, because consistency is very important, and also having a very clear target, measurable targets, also is something that is very important.
Dr. Sara, just to build off of that, of course, a big part of this is ensuring that we have the right programs in place to upskill, future generations, current medical professionals, and those who are part of that entire value chain. In that perspective, what do you think are the initiatives needed to continue that upskilling or preparing the future younger generation for the skill sets that are needed for the future in healthcare?
That's a really great question. So there is the part of upscaling and there is the part of preparing.
Yeah.
And to really bring both together, we need to work simultaneously, but there are two different pillars if you understand what I'm saying. So when we are talking about upscaling, all the professionals that are currently right now who are really dealing with all of these changes, I think it is very important to bring them on the table and to, for example, Mr. Sindi have just mentioned that in certain areas they are really focusing on let's have building cities where there are virtual cities, virtual medical cities. So it's very important for medical doctors who are working on the other end to really understand what are these tools and what are they are, whether it was on the technological side, and how do they really contribute on the green sustainability side, and how does and why we are doing that. It's not only to facilitate, for example, the day-to-day activities, but there are certain KPIs and governance metrics that are put into place, because at the end of the day, the one of the users of the system is the doctor itself or the healthcare professional. So for them, their input and their full collaboration is quite essential. And it's not only the technical side, but maybe what they would bring on the table, and they would come and say, well, listen, yes, you made our life easy in one way, but we can make your life easier for all of these innovators to look into and to provide them the tools that are usable. Now, having said that, time management would be a bit of a thing looking forward. Nowadays, doctors are very well equipped to the usual day-to-day work, seeing patients face to face. I'm talking about the traditional way. But once things are moving into the virtual world, yes, there will be a learning curve. After that, there will be a dedicated time where really focusing on these metrics and bringing these metrics of the doctors or healthcare professionals with the sustainability metrics is something that I do believe can be done. On the other end, we are still looking into traditional way of teaching our healthcare professionals. The academic world is not keeping up with the
Industry.
with many industries. The academic world is still looking into even the virtual side. It's still didactic. It's still more of teaching classroom thing, but we're just moving it virtually. But the thing is, with what we are looking nowadays is our young or Gen Zs and Gen X and the newer population, they are very well aware about climate change, and bringing that as a topic, as a full topic, full curriculum thesis, the area is not only for the healthcare field, also for the other industries that would be contributing to the healthcare field. Now we're talking about procurement, we're talking about many, multiple other areas that could really feed into that, even the telecommunication, even the media. All of this is very important. So upscaling that and upscaling our students, future students, and even the existing healthcare professionals to move forward to produce these milestones and KPI metrics in a timely manner. Sorry if I'm going too long, but
No, no.
it's a big
I was going to
topic.
ask a follow up question on that in terms of you've rightly mentioned that it's not just healthcare, but across multiple sectors. How do you see that gap closing between industry and academia? We're talking theoretical versus realistic, or practical learning in that sense. Do you see that
I
evolving?
Yes, I think we see that evolving. To start with everything, it's not only the platforms, we have the platforms nowadays. But what we need to educate is the professors and the academics themselves, to bring them on the table and to really put down programs to tell them, listen, you are, by moving towards this, you are making your life easy. As I do as I do lecture and provide certain sessions in certain universities, my life is much more easier with all of these technologies that come in now grade papers instead of academics grading papers. And maybe in the healthcare field, we need to also bring the academic world and tell them research could be done now virtually. So bring that flavor in, and this gap will close. I think COVID has closed many gaps, and this is the right time to go into a new normal and a new phase where we really need to highlight that things could be done much more easier, much more efficient. And we encourage all of these innovators to really look into academia. At the moment, it's always to the service and the end service user kind of thing. Academia is still lagging behind. So that's why we're still looking at this is in my own humble opinion, we need to bring things forward. We don't need to teach students only medical informatics, but we need to bring the green sustainable environment to the classrooms.
Engineer Mohammed, just building off of that, Saudi has one of the largest young populations in the world. As Dr. Sara mentioned, there's a recent Arab Youth Survey in terms of the passion behind sustainability for the future moving forward was a highlight of it for every young Saudi. Where do you see that collaboration coming from industry with academia progressing in that terms, in terms of the partnership, in terms of initiatives moving forward to have more of that realistic experience as well as sustainability embedded into it for the future?
Yeah, I think there are more can be done. I'm not saying there is no collaboration at all, or I'm saying the collaboration is 100% what we are looking for, but I think collaboration is there. I think there are some partnerships are being created, for example, between medical schools, between some universities in Saudi and the other private technology companies. For example, we saw, let's say, if I want to go outside the healthcare a bit, we saw, for example, what is happening in telecommunication and those kind of technologies that the company, the government are basically are trying to support to bring those kind of leaders in technology with the academy in order to give the practical missing piece to our generation. But only from my side as well. I think when I say more need to be done, it's not only to limit ourselves with the academy, with the university, but also I think if we talk about such a topic like sustainability, this is something more about culture, right? So it is something similar to when we are teaching our kids on how to drive safely, on how, for example, to behave and to talk to other people. It's the same thing, something that need to be inherited from a very, very early stage. So what I'm saying is maybe that collaboration can be even much earlier in the school with certain projects, with certain campaigns in the curriculum itself, something talking about sustainability, because at the end of the day, it's culture. It's not only something about targets. It's not only about government are pushing for that direction, but it has to be inherited in our culture.
People play a large part of the future that we want to develop, and obviously this is, as you said, culture across many countries and embedding, what kind of future we want for each other. I just it seems that we're kind of have to wrap up. We're hitting that 30-minute mark, but I just wanted to get, as we're touching on youth, just one last comment from both of you. One thing that we've seen is we've all worked with young entrepreneurs, innovators, students, and so forth. Is that passion, as we just mentioned, behind sustainability? And we have COP27 coming up in MENA. We have COP28 coming up in the UAE. As Mohamed has mentioned, there's going to be many things a part of, in that in between, that will be pushing forward, and youth play a big part of it. We've had many conversations from that entire ecosystem of wanting to no longer just be a part of the discussion, but have a seat at the table for decision making. Um, what would be, Dr. Sara, your advice for youth entrepreneurs and innovators to do in order to get that seat at the table? We're an implementation process, and our conversation with some young female graduates a few weeks ago in the energy space was that they want to be there and they're trying to work hard in order to get there. What would be your advice for the future innovators in order to kind of grab that table in that way?
Oh, that's a really great question. First of all, for anyone who's out there, never quit. Always try to bring always bring your voice higher, in a way, in a sense that you are bringing solutions to the table. And I know all these young entrepreneurs, they have a lot of solutions and a lot of innovative solutions in a much more efficient way, if I may add. So sometimes what is maybe let's say what is not providing that is that they lack the self-awareness, or they are maybe trapped and nobody will listen to us. We are here to listen. I believe that many people are here to listen. Once you are really communicating and articulating what could be feasible feasible in the society that you're living in, and bring in the solutions and never quit. That's what I keep on saying to anyone: never quit. It's always all of these great ideas. You will always find challenges knocking the right doors, but I mean, challenges getting throughout. But believe me, one day, once you present yourself right and present all of these solutions, and also present them in a way that you would like to engage for the cause itself, it will really provide itself. And start within. Sometimes we see all of these I don't know how to explain it. Sometimes we have to practice what we preach. This is where I can start talking about it. So instead of me saying, okay, I'll provide you the solution, but I'm doing something else, then please come with a recyclable bottle, rather than to the table, rather than bringing all of these other. It's just something that it brings to them, because impressions do matter.
Engineer Mohammed, we'll leave it with you to close out, just on that closing thought and what your perspective is.
Look, again, on the next generation and the youth, graduates, innovators, anyone has a great idea, or at least they believe it's a great idea. I think these days it become much easier to approach, to present it, and to get the needed support. If we compare it with like 10, 15 years ago, it was even difficult to find something in the same city, somebody to sponsor what you are told, or even to present the idea that you have. Now you can do it to multiple entities at the same time online using the technology, scaling up the technology by adding more ideas to make it much better, efficient, and also to support the society. I think this is what everyone is looking at. In Saudi, for example, again, I think there are a lot of incubators sponsored by the government, by the private, in order to incubate these kind of ideas. So there is a lot of opportunities out there. Like what Dr. Sara was saying, don't quit, don't feel, let's say, don't give up. It's more about how basically your idea is solid, and how this is ticking all the boxes and all the targets, and what everyone is looking for, and how this will impact the society and impact the people life. This is the most important thing.
Well, thank you very much, Engineer Mohammed and Dr. Sara, for your great insights today. I think I've learned a lot, and I believe all of our listeners will learn a lot as well. For all those listening, please feel free to follow both of them on social media for further insights in this space and sustainability in healthcare overall and technology. And of course, Microsoft Arabia, where we will be publishing all this content. But thank you both very much for joining today, and I appreciate your time and all the intelligence that you've shared.